Physical therapy. Before I talk about physical therapy, I want you to understand, before we take you down to the physical therapy gym, we're going to make sure that you've had two very important things. The first one is that you've had your meal. The second one is that you've had your pain medicine. If you're missing either one of those, the transport person who comes to your room will skip you, go to somebody else, and come back for you a little bit later on, because we don't want you to go to physical therapy without those two things. Physical therapy here in the hospital is twice a day. In the morning, it can be as early as 8:30, and in the afternoon, it can be as early as 1 o'clock. But if we have a number of patients who decline, are not ready initially, and maybe they were numbers 1, 2, and 3, and you were numbers 16, 17, or 18, suddenly they're at your door saying, are you ready for therapy? So keep in mind, we do want you to be ready as early as possible. Some of our patients return from surgery early enough in the day to participate in physical therapy that same day. Now, I'm not saying that you're going to be up the day of your surgery running around the room, by no means. But the physical therapist will come into the room, ask you how you're feeling, check your pain level, your blood pressure, find out if you're nauseated at all. Then we'll encourage you to sit at the side of the bed. If you feel up to it, let's stand. Let's take a few steps with the walker. And many of our patients are motivated to take that walk into the bathroom and sit down on the toilet, because, especially for our ladies, it's very difficult to urinate on a bedpan. So being able to get up and walk to the bathroom with our help is very important for our patients. So we do encourage you to give it your best shot. Do not, under any circumstance, get up by yourself, because that can only cause major, major, major problems, okay? Now, equipment. When you're laying in bed, you're going to have devices called foot pumps. And the foot pumps will fit on your, if this is your foot, it will fit around your foot. And if this is the arch of your foot, what it does is it sends a pulse to the arch of your foot every so many seconds. And what that stimulation does is it causes the blood to flow in your leg as if you were walking. And that's very important because it will help decrease your risk of a blood clot. The walker, my favorite piece of equipment. This walker is what we call our standard walker, in that it doesn't have wheels on it, it doesn't have any other devices on it. And the sequence with the walker is very simple. Once you're into the standing position, and I'll go through how to get into the standing position a little bit later on, the first thing you're going to move is your walker, okay? And it's important that when you move the walker, you're moving it far enough, but not so far that you're doing one of these, okay? So move the walker. And then the next thing you move is your surgery leg. And just for the sake of discussion, let's say I had a left total knee done. So the next step I would take would be my left leg. And the reason for that is when I go to take the following step, I'm able to put weight on the surgery leg and also on the walker, and then bring my non-surgery leg up. So the sequence is always going to be walker, surgery leg, other leg. And I encourage patients and staff to use the terms walker, surgery leg, other leg. I discourage people from using good leg, bad leg, because what's the good leg for the patient may be the one they had surgery on, because the other one is just as bad. So it's always walker, surgery leg, other leg. And then one of the other things we use are TED stockings. Not all of our physicians are using the TED stockings, and the reason for that is by their personal preference. Some physicians feel the TED stockings are devices that should be worn all day long for an entire month. Other physicians feel that if a patient is up, moving around as aggressively as we do in physical therapy, and they're on anticoagulants, that they really don't need the TED stockings. And that's something for your orthopedic surgeon to decide.